Good morning.
Good morning.
Hi, Leo. Good morning. Good morning. How are you doing? Oh,
Yes.
good. How?
The acute rehab unit is one of my favorite places in the hospital. Something happened in their life that caused their mobility or their ability to take care of themselves to be altered. And I like to describe it to patients and families as boot camp to really get you back on track to optimizing kind of how you're living in your life outside of the hospital.
We take kids of all ages, as young as 8 to 9 months of age, up to 20 years of age. We have dedicated rehabilitation nursing, as well as, you really get the comprehensive care, including dedicated rehab music therapist, a dedicated rehab child life specialist, a facility dog, as well as a school program.
They help with the emotional support in staying in the hospital long term, help with understanding from a child's perspective what's going on, why am I in the hospital, why are my legs different.
It involves intensive therapies, 3 hours a day, split between usually physical therapy, occupational therapy, sometimes speech therapy as well, to really lay a good foundation.
So increase the child's independence in dressing, in then brushing their teeth, washing their face, being ready to face the day.
The goal is that patients wouldn't be bored, that they'll feel that their time is fully utilized on the rehab unit.
Often parents are wondering, can I stay with the kid? Can I be involved in therapies? And the answer is yes. Like, you can still stay overnight with your child. Often we do want you to be involved in therapies because when you leave the hospital, you're going to be the one taking care of the child, making sure that they're staying safe at home.
So we are licensed for 12 acute rehab patients per day. Our bed max is 19 beds, and we try to put our rehab kids in single rooms so that they can get their sleep at night, and so they can function at their highest level while they're receiving their therapies the next day.
We are more and more often able to say, okay, you have 3 important family members. There will be times you can bring all 3 of them to the bedside.
It is rare that a child needs to transfer off of the rehab service to the intensive care unit or higher level of care. But when something happens that step is necessary, the intensivists are at our bedside, within minutes. Having that access to immediate access to higher level of care, that's another level of comfort that, hey, my child is safe here.
Our rehab unit is the only ventilator-certified unit in the hospital outside of the ICU. And so all of our nurses are trained for management of patients with tracheostomies and ventilators. We have 2 dedicated ventilator rooms.
Also, our own rehab social worker, who is amazing, who is so well-versed in really providing social support to families who are going through one of the most difficult times in their lives.
It's usually during their rehab course that families are processing their grief and anxiety and, thinking what is the future going to look like?
You can do it.
We try our best to give them the tools to, continue to care for their child. And sometimes, hopefully most of the time, we're able to offer some hope that even though things will be different or maybe different, they'll be okay.